Okay, so the tonicity of solutions. So if we have 3 beakers here, and we filled it with deionized water, and then we add a erythrocyte or red blood cell to each of those beakers, and then we change the concentration of solute within that solution, we're going to get changing tonicities of that solution. And so the way that these solutions are named is going to be based on the concentration of solute in the surrounding solution. So not what the concentration is inside the RBC, but the concentration of solute that is in the solution surrounding the red blood cell. So in beaker number 1 here, we have a solution that is considered hypertonic. So hyper meaning more. We have more solute surrounding the RBC than is inside the RBC. For an isotonic solution, we have the same concentration of solute outside of the RBC in the solution as we have in the intracellular solution. For a hypotonic, hypo meaning lower, we're going to have less solute surrounding the cell than is found inside of the cell. So how is the red blood cell going to react in each of these different solution environments? So in the hypertonic solution, we know that water via osmosis, the movement of water from high concentration to low concentration, is going to want to follow solute. So because we have more solute surrounding the RBC here, water is going to want to move outside of the cell. And as a result, the RBC will shrivel. For the isotonic solution, this would be physiological saline, for example, is an isotonic solution. And because we have the same concentration of solute surrounding the cell as we have inside of the cell, there's going to be no net movement of water either inside or outside of the cell. And so that RBC is going to remain unchanged. So no change. Delta symbol indicating change there. For the hypotonic solution, we have less solute surrounding the RBC. We know that water is going to want to follow solute. So water in this case is going to flow into the cell. And as a result, that RBC is going to explode. It's going to lyse. So that is how an RBC will react in different tonicities of solution.